Welcome back. It's been 10 days since President Donald Trump signed a new executive order recommending some major changes to the childhood vaccine schedule. The White House calls the move a win for parents' rights, but leading pediatric groups warn that it could create some confusion for families.
For example, at 1 year, you should have 5 separate visits for vaccines rather than getting them all in the same day. Decades ago, children received only a small fraction of the vaccines required today. In those times, people were much healthier, and of course, the high rates of autism now observed did not exist.
All right, here is what's new. The executive order recommends cutting universally suggested childhood vaccines from 18 down to 11. It also advises states split the combined MMR vaccine, that's measles, mumps, rubella, into 3 separate appointments. Now, while the White House is pushing these new guidelines, it is important to remember that individual states, not the federal government, hold the final authority over school vaccine mandates. Major medical groups, including the American Academy of Pediatrics, warn that adding extra doctor visits could cause parents to fall behind on routine immunizations. So this morning, we are talking with experts, including Dr. Mysheika Roberts, the health commissioner for Columbus Public Health. You've come in to talk to us about this very critical subject so many times, and we appreciate it. As somebody who has been on the CDC Vaccine Advisory Committee, what's your initial reaction to this executive order?
I'm very disappointed. I think this executive order causes a lot of confusion to our families and our residents about who to listen to, what to do, what does this mean, why would an executive order be signed for something like this? We all have to remember vaccines have been around for decades. They're very safe, they're very effective, and that's why we don't see these diseases in our communities, because we're all getting vaccinated.
So one of the things that stood out to me is splitting that MMR into 3 different shots. And if you've taken a baby to the doctor and they get that one shot, they start looking at people kind of sideways. Even when they're young, they know that. Why is that seen as important? What difference could that make?
Well, that's a huge barrier for our families and particularly our young children, because now they're getting more shots and they're spread over time. And so that means more visits to the pediatrician. That could be a financial expense to the parent, because not only will your insurance be billed for the shot, but also for each doctor visit or nurse visit for that shot, not to mention time away from work or whatever your livelihood might be to get those shots. And then the discomfort of getting multiple shots for the child is not something that I would recommend. There's no science behind that whatsoever that suggests that there's an advantage for immunity for the child to get multiple shots for the MMR. That's why it's combined to simplify things, make it easier for the child, for the family, and providers.
All right, so you talked about the confusion. What should parents, guardians be asking their providers? You know, I'm thinking about people with young children, but if you've got, you know, these middle and high schoolers, maybe somebody going off to college, you're thinking about meningitis vaccines, flu, all of that. What should we be asking?
Well, I think the first thing you should be asking your provider is, are you changing your practices because of this executive order? And I think most families would be surprised to find out that most providers here in Central Ohio will not be changing their practices. We've heard loud and clear from advocacy groups like the American Academy of Pediatrics, from the Infectious Disease Society of America, long-standing professionals who follow the science, who say, we're not going to change.
All right. Are you seeing at the Columbus Public Health that are you seeing more people coming in for vaccines? Are you seeing any confusion?
I will say, in general, we're not seeing any more confusion than we've had over the last 4 to 5 years. I mean, there's definitely been a decline since the 2019-2020 school year, where less kids are getting vaccinated, and particularly with the MMR. We're also seeing more kids, not only here in Franklin County, but across the state, where their families are doing a non-medical exemption for their vaccine coverage, which is concerning. And this is why we continue to see these measles outbreaks, not only here, but across the nation.
All right, Dr. Mysheika Roberts, thank you so much for coming in and helping us kind of walk through what's ahead for parents who need to take care of their children. We do appreciate your expertise.
Happy to be here.